Hi, everyone. It's Alex Savidge from KTVU, Fox 2 News here in the San Francisco Bay Area. And we want to talk about some of the latest headlines surrounding the coronavirus outbreak in this country. And to do that, we bring in Dr. Hansa Bhargava, a pediatrician and senior medical director at WebMD. Dr. Bhargava, always good to have you.
Great to be here, Alex.
I want to talk first about a situation that we had unfolding here in the Bay Area that I know you're familiar with. In Sonoma County, there was a series of coronavirus outbreaks linked to a number of different preschools and home daycare centers. 13 different facilities involved. A total of 62 people became infected with the virus. This included, kids, family members, staff members as well. Overall, how concerned are you to hear about a situation like this as we continue to talk in this country about trying to get more and more schools reopened for in-person learning?
Yeah, and I think unfortunately, I'm not surprised that some cases came out, and that will happen. And I think the lesson to be learned here is really that we have to be really vigilant about the guidelines of masks and social distancing, make sure that policy is prevalent through all the employees and every childcare facility, but also that we have to do the honor system as parents and not send our kids to school if they are sick or if they have any other symptoms.
When you hear about an outbreak like this and it's spreading among kids and then among family and staff, does that make you think that in all likelihood, these kids especially were probably not showing symptoms?
I think that it could be that, or it could be what we as parents, and I join as a parent as well and a pediatrician, what I've seen in my office is that parents, tend to sometimes say, oh, it might be a cold, or it might just be a cough, or it might be allergies. So it's okay for the child to go to school. But now in these circumstances, Alex, I think we have to be really careful about those symptoms and keep your child home if necessary and potentially get them tested. So now more than ever, we need to do that. So yes, to your answer, it could be asymptomatic, but it could be symptomatic too. It really depends on how closely the community is following the rules.
Yeah, right. And how closely someone is paying attention to the symptoms that maybe their child has, and whether they, like you said, pass it off as maybe being something else, some sort of other illness here. As we begin to sort of talk about the idea of more schools returning to in-person learning, as we start to see cases nationally begin to trend in the right direction here, what do you think about the idea of regular testing in the school setting? I mean, what would that look like, and how critical do you think that could be to really getting as many kids as possible back in classrooms?
I think that there needs to be a number of policy rules around that. So it includes the mask, social distancing, cohort teaching, but also testing, as you pointed out. I think, in the most ideal circumstances, if the schools have the resources, they should be testing the kids before they go back to school, and then have randomized testing on a regular basis as well. Some schools that I know of have adopted that actually, and they don't test the entire school necessarily, maybe 10 to 20% of the school every few weeks, but that actually helps helps not only test the kids, but also reinforce to the parents how important it is to be vigilant about all of those rules inside and outside the school.
A lot of schools, some schools are returning, and, there's obviously kind of fits and starts when you have kids, coming back into the classroom setting, and then you have outbreaks, and then you have to shut down schools. And then there's places like here in California, for the most part, I mean, most of the districts here are opting to stay with virtual learning at least until the end of the year. You feel like, do you have some optimism that maybe places where it's still virtual learning entirely, that maybe we might be able to shift to kind of a hybrid model, maybe by the second half of the school year?
So I think that it depends on the community infectivity rate and the case rate. That's what all, public health rules need to abide by, but also, of course, personal circumstances and what parents feel safe with. But Alex, I would say that, if it was possible, it would be, of course, nice to have the kids in school, but I'm not really sure if that's going to happen for most people, because I don't know that the schools are able to have all the resources they need to do that. And also, again, it's a community issue, and whether the parents will abide by the rules, whether they can because they're essential workers. There's just so many complexities. So I wish I had a straightforward answer, but there isn't.
No, it's not an easy question to answer. I certainly get that. Let's move on and talk about another topic that has a lot of people talking already, even though we're a little bit ways out from Halloween, but everyone is having conversations already about what the holiday is going to look like here in the middle of this pandemic. I was mentioning to you that here in California, the public health director for the state said that trick-or-treating is not advised. How much concern do you have around people going door to door and trick-or-treating at Halloween? What are the biggest issues that you think that could pose?
Well, I'll tell you right now, Halloween is one of my favorite holidays. So I would be very sad, even as an adult, if it was completely canceled. But I think that everything in our world right now is in an atypical version or a modified version. And I think for Halloween, we're going to have to do that as well, right? Like, it's not going to be, we almost live in a new normal now. So I would say that we could do Halloween, but not the way it was done before. So this is the time where we think out of the box, have innovative ideas on how to do this, and, pitch it to our kids in those ways that, hey, we are doing Halloween. It's just going to be a little bit different this year.
All right. So is the bigger concern with Halloween that the fact that you have strangers, interacting, the normal situation when you have with trick-or-treating, strangers that are going to be interacting potentially in close contact with each other and transmitting the virus? Or is there still the concern around, bowls of candy being, people reaching in, grabbing at the same candy all at the same time? What are the biggest concerns from a health and safety standpoint when you're really talking about trick-or-treating?
Great question. I think most COVID is transmitted via respiratory. We know that now. Of course, there's some data that's showing that it lives on surfaces. It's not clear, how much of a transmission happens that way. Regardless, I think when strangers are interacting, it's bubbles interacting, right? Like, each person has a group that they carry around with them, like they've seen or interacted with, 8 or 10 people. So if you have 8 kids, that's 80 people. If you look at it from that perspective. So I think when kids cluster at a door, or they are too close to the people who are answering the door, then that is cause for concern. So there's some ways that we can prevent that from happening, and that is what we're talking about, a modified Halloween.
It's just going to have to look different. What about, this is my last question on the trick-or-treating thing, but what if I like left a table and individually sealed candy, that was separated on the table, and folks at a distance, just waved and said hi and grabbed a piece of candy? What about that?
Yes, I don't think we have to cancel trick-or-treating entirely. I think we just have to be careful. So I think that's a great idea. I posted something on Twitter and asked my fellow doctors and nurses in a survey about it, and there's some great ideas that came out. So some of the ideas were, a neighborhood Halloween parade, with kids walking 6 feet apart, with the parents watching in separate groups. Some other ideas were like trick-or-treating in the home. So a doctor said their 5 and 7-year-old would be trick-or-treating in all, the bedrooms and the living room, and the parents would be around with costumes. Cool. That was really cute. There was a great post on Facebook by a parent who created a tube to kind of like throw the candy in a tube down the stairs when somebody came to the door.
Oh, okay. All right.
Beautiful. Back there, and that was like a fun thing. So I think there's lots of fun ways around it. I think the basic things you have to remember is, of course, masks, of course, social distance, and of course with cohorts. So don't mix with large groups of people, but I think there's innovative ideas.
Okay. Well, luckily enough, Halloween is one of those holidays where a lot of people are wearing masks anyway. So it's good. We're all set. Hopefully on the mask front, we have folks in masks, but the key is keeping your distance and obviously not interacting directly with people outside of your family or your bubble. Let's wrap up here and talk about the concerns for later on this year in the fall when we have flu season, coinciding with the COVID-19 pandemic. What are the biggest concerns about what people are calling this twin-demic? What are we worried about happening here when these two viruses sort of collide?
So Alex, the flu generally comes in, late October, November to, March, February, March. And the flu is a known entity to cause thousands of hospitalizations and deaths, and in fact, even deaths in children. So it is a serious issue. And we have a vaccine for it, right? So it makes sense to get that vaccine. This year, it's really important to get the vaccine because now we have two potential pandemics, two potential serious illnesses colliding at the same time. What does that mean? Well, the symptoms are very similar, and also the ERs could potentially be flooded with both. So if there's any year, I would say get your flu vaccine. And I say it for every year, but especially this year.
Can you get, or do we know if someone could get the flu, the seasonal flu, and then also get COVID-19? And then, on top of that, would getting the flu, let's just say, make you more susceptible to catching the coronavirus or becoming more sick? Getting more severe symptoms from the coronavirus.
Well, we don't know that for sure. Certainly, if you have been infected by something else, often your immune system is trying to recover. It's just like, if you tried to lift, weights for 2 days in a row, you're not going to be able to lift anything else the third day. So it's the same kind of thing. But I think the most important thing to remember is that you really don't want to get symptoms that are similar to the other thing or show up to a packed ER or doctor's office, because then basically you are exposing yourself to the other infection, whatever, whether you have COVID or flu, whether you just have a cold. I mean, it's really hard to distinguish. So getting the flu vaccine will at least use the vaccine or tool that we have so that we can at least protect against the one thing that we know about.
Is there a key time to get the flu shot? I mean, is it like I should have gotten it yesterday, or is it, you hear some people sort of theorizing that if you want to, you kind of get it later once the flu season kind of really takes hold, so that your immunity lasts longer throughout the flu season. Is there a right time to get the flu shot, or is it to just do it right now?
Yeah, I would do it right now because we're we're in the middle of September, and flu can start anywhere from the end of October to February. So you're kind of in the right time frame, and the immune system usually takes about 4 to 8 weeks to ramp up. So I think that you are in the right window right now. So I think it's a good idea to get it. Remember that some doctors' offices will be offering it, but also pharmacies will be offering it. So there's lots of great ways to get the flu vaccine. So I would go out there and just get it. Get it for your children.
It's so, really, it should be widely available and widely accessible this year. Last question on the notion of the twin-demic and these two pandemics coming together. Does it even make a difference if we have, let's say, a mild flu season as opposed to a very severe one? I mean, that's still just as much of a concern, right? When you already have COVID-19 out there.
I think it is a concern. Certainly, if we have a severe one, that means more hospitalizations and more beds being taken. And then, gosh, like if there's COVID having this more waves, then that means potentially deficiency of beds. And that means that, longer waiting time. So I think we definitely want to protect against what we can protect against. And that's taking the vaccine for the flu and then wearing masks and social distancing for COVID.
Absolutely. Yeah, we can't let up on all of those the safety measures that we're doing here. And a lot of folks are doing really well with the masks and the distancing, and it's good to see. All right. So get the flu shot yesterday. Well, that's the bottom line, right?
And I gotta say, like, I'm so proud of everyone doing a great job with the masks and social distancing. Like, I just feel like it was a big change for all of us, but I feel like now people are carrying that like they carry their car keys. I mean, the mask, the car keys, the wallet, right?
Yeah. No, and it makes me happy when I rush out the door, like with my 8-year-old son, and he grabs his mask on his way out the door without even anyone even saying anything anymore, and it's like, there you go. That's great. It's good. All All right. Well, thank you for coming on. Always good to chat with you, Dr. Hansa Bhargava, pediatrician and the senior medical director with WebMD. Look forward to talking to you again soon. Have a great week.
You too. Thank you.
All right. Take care.